friends, this is Dr. Abdequaem Chimthanawala. Let me today tell you a very interesting case which I had. That patient had come after an appendix operation. He came to me and he told me after that operation everything is fine, all reports normal, but I find difficulty in breathing. So this was the case, the difficulty in breathing, and he feels that he could not expand his lung more. We expand the lungs when we breathe. He could not expand the lungs and he has difficulty in breathing. A very important symptom, but then when you always periodize that maybe because of anesthesia, elements from anesthesia, and there's a problem in breathing, prescribe the drug we have, don't be so prejudiced. See exactly what is the pathology the patient is suffering from. That is also sometimes important for us. Now we had a case where the patient had symptom of difficulty in breathing because he could not expand his lung. So his respiration was shallow respiration. He did not have the normal respiration like that we do. So it was because he could not expand the lungs, the respiration was shallow. Definitely there was obstruction to breathing. The gases exchange was not taking place properly. Now if you have this in mind, that maybe after anesthesia, after appendix operation because of anesthesia, he might be suffering from this symptom. So actually what is this? That means there is obstruction, the gases exchange is not taking place properly, maybe a collapse of lung which is unilateral or bilateral, and you can see that shadow in the X-ray. This is actually what is called atelectasis. And if you see the rubric atelectasis, you have drugs less antitar, hyoscyamus and sulfur. So this becomes a very important symptom in our case where the patient is not able to expand his lung. Maybe because of the operation, maybe because of the anesthesia, he is suffering from atelectasis. And these were the two symptoms the patient came to me. Of course, if you get this symptom, then when you take the history, if he's telling you a precise history after appendix operation, after anesthesia, he has a symptom, then you must think about all that lines. The patient was lean, thin, and a lean, thin patient, neurasthenic patient. He also complained of pain in the spine. Before the operation he had, but means he used to tell that थोड़ा भी भारी काम कर लिया मेरे को स्पाइन में दुखता है, मेरी स्पाइन अकड़ जाती है, थोड़ा भी सोने में थोड़ा ऐसा सो गया तो स्पाइन में तकलीफ हो जाती है. That means by trivial cause, like if he does not sleep properly, if the position is changed, he has pain in the spine. He had weakness of the spine. He could not lift weights. If he lift weights, he had problem in the spine. So maybe a spine was sensitive, but this symptom was a very important symptom. Now if you repetize this case, atelectasis, and cannot expand the lung enough, a very rare remedy that comes to a repertory, and that is Strychninum phos. I gave him Strychninum phos 200, 2 doses, and called him after 15 days. And to my surprise, when he came, he was very happy. His breathing was normal, and I was so happy to see him breathing properly, because when you cure a condition like atelectasis or you get relief in those conditions, you also feel happy that you have done something for the patient. So he told me whether I can go for an X-ray again. I said no, wait for some time, let's see. And in the course of 3 months, he was absolutely normal. The X-ray was normal and the breathing also was normal. But then I learned Strychninum phos on that day. Only 2 symptoms, atelectasis and cannot expand the lungs enough, or the patient feels that he cannot expand the lungs. If you go deeper in Strychninum phos, the patient lean, thin, problem in the spine. If you go to see Strychninum phos, there was one symptom I would like to add in Strychninum phos, 2-3 symptoms. That is, the first symptom is the patient of Strychninum phos has a symptom called anemia of the spinal cord. And in this patient, before the operation also, a lean thin patient, he had this symptom. Though we did not take it for prescription, but if you take that also, anemia of spinal cord, you have Strychninum phos, you have Kali phos, you have phosphorus, you have Nux omega, and you have Silicea also. Anemia of the spinal cord. I would like to add one more symptom, that is, if a patient, a lean thin patient suffering from eczema, you must think about Strychninum phos. And one more symptom, a very interesting symptom, I would say, a very rare symptom that you will get in Strychninum phos, that is the patient laughs at trifles. Means the patient laughs at small things also, which normally we will not laugh, but this patient will start laughing. Laughs at trifles. That I have seen in patients of Strychninum phos. So today we learn 2 symptoms of Strychninum phos where we cured a case, and 2-3 symptoms of Strychninum phos when we study the mathematics of Strychninum phos. Atelectasis and cannot expand the lung is the case of atelectasis, and second part where anemia of spinal cord, eczema of neurasthenics, third symptom laughing trifles at Strychninum phos. So my friends, go home, read the mathematics of Strychninum phos, and I'm sure that when you prescribe on these symptoms, you will definitely get results, and you'll be happy that you have prescribed Strychninum phos, a very rare drug. Today we have learned. I'm sure you must have liked this video, and if you like this video, please do share and subscribe. Thank you.